Okay, we're going to be talking about necks today. Sorry, the other day we kind of got a little technical difficulty, and I'm looking at my hair and thinking I need some hair color pretty soon. But let's talk about necks. It's been really popular. Lots of people want to know what to do about their neck. We forget and we forget to put sunscreen on. So we've got a lot more damage. A lot of people will also pay for treatment for their face, but they'll just forget about their neck and décolleté. So, you guys as professionals have to really point this out. I was actually testing some stuff on my neck. So if it looks a little red, that's why. And we'll go over a little bit about what to do treatment-wise, and then what home care works really well for the neck area. I'll share with you some technology that we've been using to treat the neck area. And we'll also talk about skin color and difference in skin color. You can see that little bit of redness in my skin right now. And a lot of clients that come in with that flush redness, we will talk about how to treat it. So I'm excited about this topic, and it's a lunchtime topic. So it's meant to be quick and just kind of give some food for thought. Please bring me your questions, call with the questions. We'd love to answer any questions. Since we're not going to be interactive right now in this recording, just please bring anything that you have to us, and I will answer it the best that I can. So starting with necks, I'm going to try to find our little picture of our necks here. And now we're sharing. Okay, so you guys see, this is a common client that comes in. They got a little bit of the gels that are kind of sinking down into the neck area. Lots of wrinkles that kind of come across the neck right here, tiny fine lines. You see the pigmentation issues that they're having, along with, back up here, the platysma muscle. That is a very important muscle there, and the little fat pad that kind of happens underneath the chin here. These kind of problems are stuff that we really cannot treat aesthetically. They have to more or less be treated medically. What we can do is we can soften all of these fine lines and wrinkles, and we can help with a little bit of this tightening with some microneedling, which will show that. And then with IPL, we're going to address colors in the skin, reds and browns. Very important to know that you cannot treat the redness of the neck with a lightening product or with light skin peels, because they are vascular. Vascularities have to be treated with IPL. Everybody wants a softer, smoother looking neck. It kind of ages us when we look down. We have this perfect skin, and then we look down at the neck and décolleté, and we've got this, freckling, fine lines, sun damage, patchiness to the skin. Here's someone that has got the redness that we just talked about. So you can see a little bit on the chin area, probably has a little rosacea on the skin, and then the rosacea redness has carried down into the neck area. This skin can be treated with a combination of things. So we're talking about IPL for the reds and the browns. Remember, the reds are vascularity, and these fine lines we will treat with some microneedling. This is actually has got to be treated more medically. You can see kind of where that platysma muscle has just kind of separated and started sagging. This actually has to be tacked back up surgically. Can we actually soften some of this fine line and wrinkling? Yes. Can we, get rid of some of this pigmentation issue? Yes. But these muscles here have really got to be retacked up. So I don't think that I would promise a client that came to me with this sagginess and this sagging of the platysma muscle and say, yes, I can definitely take care of this. I would say a combination of both. I think people really appreciate when you're honest with them on what you can take care of and what what medical has to take care of. And it's basically here. I'll show you the muscles. So these are the platysmal bands. Sorry. And these are what, I'm so sorry here. These, these are exactly what let go and what needs to be retacked back up. You see that muscle and that platysmal band there. Again, here is another look at when that muscle kind of starts to sag and needs to be put back up. Another thing is this like light chicken skin. If you guys see that, it's kind of got those white bumps to it. This is going to take a combination of a couple of things. You know, your light skin peels are going to work really, really well on this skin to help with this kind of chicken skin look to it. IPLs to address the browns and the reds. And then, of course, if they want it perfect, you're going to have to go surgical and really kind of tack these bands back up. Okay, so what do we do for home care? What do we do for treatment? We started using a combination of light therapy. We started using RF, radio frequency, microneedling for the neck. And if you're not able to do microneedling in your state, then the nanoneedling works really, really well. And that's using this little device. We've seen several of them, but this is the one that we sell, where you can control the depth or the speed. And then with the needle and the little handpiece here, you can control, you know, what depth you're working at. You would really only need a 0.25 when working on the neck lines, because remember, underneath the eye, the lip, and the neck is all the same thinner skin. So it can't tolerate and doesn't really need something more than that 0.25. And the 0.25 you'll find on your dial when you dial in your needle. Why do we want needle? Why do we want 16 needles or 12 needles or a nano needle? So what we want to do is we want to go into these fine lines here and we want to irritate them. We want to cause collagen and elastin to kind of heal this area. So we want to cause a light wound, and that will cause a tightening and a rejuvenation. So we want that little kind of valley to kind of come up and meet the hill. And that's what we're trying to work towards. So as we go in there and we irritate a wrinkle anywhere, we're going to get that buildup of collagen and elastin in that area. Now it's going to be important for them to keep up those treatments to keep that skin rejuvenating, and it's going to be important for them to use home care to treat the area. Remember, as treating the face, if we're using a retinol on the face, we should use a retinol on the neck. If we're using a sunblock on the face, we should be using a sunblock on the neck. The neck gets avoided a lot of times. We just forget. We're wearing V-necks, and then our décolleté, neck, and even ears do not get the proper care that they need or protection. So remember, those are all skin and should be treated exactly like we treat the facial area. So ears, neck, décolleté, and face, all treated the same way. One of my fun little tools that we sell is this little neck treatment. So I find that this is a great device to send home with clients. It's not going to take away from anything that you're doing, but it's just going to be a great means of putting in your moisturizer. So we're going to take a little bit out here. This is our neck cream. Our neck creams are fortified with peptides. Why do we want peptides on the neck area? Because we want to really rejuvenate. Peptides are anti-aging. They help with rejuvenation. And we're just going to use this little device. And this makes it even more fun to put on neck cream at night. You guys see the LED light there. You can change the light. There's a blue, there's a red, and there's a green. You want to go through and do a combination of all of these on the neck area until your moisturizer is penetrated in. Rest and Restore hyaluronic acid is also good for the neck area. This is really soothing, especially after doing a treatment with microneedling. But this is an at-home use. We use it in clinic too. You guys can see that, how smooth that gets. And then you can also just change your light. Has a little bit of vibration as well. Blue generally is, you know, for acne and to sterilize the skin. Green is rejuvenating, so is red. But see all that stimulation I'm getting, all this red, all the blood flow, really important. Blood flow, the blood flow brings oxygen. Oxygen brings more red blood cells, white blood cells to the surface, and that gives that skin a smoother look, a more vibrant look. Now I've been treating with IPL in my neck area for a while now, so I don't really have any reds and browns there. I can't say that for like the chest area, which I will address in the fall, because it's just really hot here. It's like 107. So even if we wear sun protection and we're out, it's just really, really warm. So in areas where you have warm climate and sun, you want to wait till the fall. Now, another neat product to do on the neck area is this ageless peptide serum. And you can layer the neck cream. So we have the Refirm peptide cream and the ageless. You can layer these. So first putting on your serum, couple pumps of serum, put it on, then your cream. These are excellent for rejuvenating. Peptides are the new anti-age ingredient, and we're formulating with a lot of the peptides for eye area, for neck area, for face. They're universal. There is a smaller peptide that addresses any kind of fine lines around the mouth or the eye area. The neck and face also uses other different peptides, but you will find peptides in a lot of our anti-aging, especially our black line, which is our anti-aging line. Perfect. So layer with your serums, then go in with your cream. And if you want to have these little nifty neck treatment pieces, this will just penetrate everything in. You can kind of see that little platysmal muscle on me, and you can kind of see it's kind of going back and softening. Excellent. So we treat needling, we teach needling, and we definitely do these at-home devices, and we use them in the room. So it's soothing, it's calming before we do the massage, when we're addressing the neck area. It just really gives it this kind of red flushed area, again, bringing in collagen, elastin, and oxygen to the area. So it rejuvenates. Muscle stem. This is another type treatment that you can do that we've been playing with in the clinic. And this actually just causes this little muscle here, which is that platysma muscle, to just kind of tighten. When you can tighten it, if it's at the beginning stages, you can cause a little bit more firming. So always good to use this treatment in-house. There's devices out there right now all over the internet. People are grasping for rejuvenating treatments and more of what they can do at home. So you, as the professional, besides doing in-clinic, because nothing really takes the place of in-clinic machines or peels, you need to give them a little stuff to do at home. That way they stop looking on the internet and they stop searching for something because you have satisfied that need for them to get some kind of device. You know those clients that I'm talking about. You have those other ones that are like, no, I want you to do it. And you have those other ones that want to get everything possible to help. So these little home devices are not as strong as your devices in the room, but they sure make a difference at home, and they make things more exciting, putting on your skincare products. Let's see what else we have here. Rapid Renewal Serum. Really good with the retinols and AHA, and Mega C. Mega C is a really important vitamin to the skin, face, neck. It's great because it also has the peptides in it. Again, in the black line, which is our anti-aging line, you will find vitamin C, and now we whip some peptides in there, and it really helps that aged skin. When this is really great for someone 50s and 60s, when C really doesn't work as well, you're talking about 60s, 70s, 80s, that is when you're going to go into your Rapid Renewal Serum. Rapid Renewal AHA, alpha lipoic acid, is a very potent antioxidant that actually helps rejuvenate, again, the older skins. So it's really good for somebody in their 70s, 80s, 60s, 70s, 80s, when vitamin C is just not giving the skin enough. And then the ageless peptide can be layered on top, just more stronger peptides to help with those contractions and those lines. Even with the ageless, you can use the needling pen to actually needle in, or you can use the nano. The difference between the nano and the needle, the nano is like a crystalless microdermabrasion head. Basically, it's got little tiny crystals in there, so it won't cause any bleeding. And it's going into the upper layers of the skin. So the state cannot say that you can't do that one, because if you can do microdermabrasion and ultrasound, you can do the nano needling. It's still treating the same area, those upper layers of skin, but it does help penetrate your peptides deeper into the skin area. You'll just have to hold the skin tight as you're doing it, and in those little lines, make sure you just really get those lines, and then the whole rest of the area that will tighten. Go behind the ear to finish, just because you'll have this strip of skin here that people can still see, especially if they wear their hair back. So treat all that area. Plus, if you're treating back here, you're giving that neck a little more lift, because this is kind of drawing upward. Okay, what else? I did have somebody that really liked to use the high frequency one. And again, it's all about the oxygenation. You smell it. And if you're just trying to rejuvenate maybe a younger neck, doesn't really have a whole lot of wrinkles, laxity, this is really good. You can see all that red that's coming. So that's all oxygen. It's bringing all that blood cell in to actually stimulate, heal, and give a nice tightening to the skin. This high frequency is also good for hair growth. So it's got a little hair device on it. You can run it through your hair and stimulate hair growth. But great for acne as well. But I'm using the red, which is the Rejuvenator. And as you see, all this redness is oxygen. I can smell it, smell the ozone in there. So you don't have to have fancy equipment to do oxygenation into the skin. Your high frequency does it. Your needling, your little kind of neck device, anything that's stimulating is bringing that blood flow up there. It's getting that oxygen to the skin. Oxygen to the skin is just very important for overall health of the skin, color of the skin, and texture of the skin. So I can't say enough, but home care, they need to go home with the peptide cream. So the Refirm peptide cream, the Mega C is great for your younger skins. The ageless peptide kind of took the place of wrinkle release. So this ageless peptide is really knocking it out of the park with its strength and peptide. So if you've used the wrinkle release in the past and loved it, you will love this one just as much. And then other than that, we can probably take some questions. We have videos of some of the needling, and we'll get some more videos of needling if you guys need anything answered. question-wise, like on any of the implements, you're more than welcome to call your sales associate. Brandy is doing the sales in the sales office. She was excellent. She ran one of my busiest locations, med spas. So she has a lot of knowledge about med spas and treatments that work, along with sales tips that she can share with you. So please reach out to her. If it has to be a question for me, she'll reach out to me. If it's something for marketing, they'll get that to Katie. But other than that, really in the fall, start treating necks. It's really lucrative and it's a necessary treatment and a necessary home care for aging skin. Thank you again. And hopefully we'll have some more lunchtime talks. We have once a month where we're planning this. If you guys have something that you'd like us to talk about, please just go ahead and email us or call and just kind of put that in our ear, and we will research and bring you guys some really great treatment and answers. Thank you so much.